Hello and welcome to Insight Ophthalmology. This is Dr. Amrit welcoming you to another lecture. Today we are studying the fundus fluorescein angiography. In the first part of this video, we shall be studying about the normal pattern on the fundus fluorescein angiography of the retina and the choroid. And in the next video, we shall be studying about the abnormal FFA angiography. So what is meant by fundus fluorescein angiography? The FFA, that is the fundus angiography, is also a diagnostic technique that allows the sequential visualization of the blood flow simultaneously through the retinal, choroidal and the iris tissue as we put a fluorescent dye into the bloodstream via the vein of a patient. This fundus fluorescein angiography is based on the principle of fluorescence. Now, what is meant by fluorescence? Fluorescence is the property of a certain molecule to emit a light energy of a longer wavelength when it is stimulated by a light of shorter wavelength. We are all aware of the acronym VIBGYOR. This acronym VIBGYOR actually represents the visible light and its component according to their wavelength. As we all know that the violet actually has the least wavelength and the red has the maximum wavelength, and below the violet is the ultraviolet, that is 300, and above red is the infrared, which is the maximum wavelength. So in fluorescence, or an object which is said to be fluorescent, what it does is that it will actually, whenever it is stimulated by giving it a light of shorter wavelength, say blue, green or violet, it will actually be emitting the light energy in a longer wavelength form, that is yellow, orange or red. Now, as it emits this light energy of longer wavelength, what happens is that this object is will start to glow. Okay, and it will become more visible, and this is called luminescence. Okay, so what happens is that as the property of fluorescence occurs, there will be luminescence of the object, and this is called fluorescence. So this is the basic principle behind the fundus fluorescein angiography, that is the property of fluorescence. Our oceans and marine life is full of this property of fluorescence, and you can see so many plants which are showing these different colors, and all of this is because of the fluorescence. So before we understand the fundus fluorescein angiography, it is very important for us to have a brief idea regarding the vasculature of the retina and the choroid. Since the name suggests fundus fluorescein angiography, it is actually showing us the architecture of these vasculature which is present in the retina and the choroid. The main artery which is supplying the retina and the choroid is the ophthalmic artery, which is coming out from the first division of the internal carotid artery. There are two main important branches with respect to retina and the choroid that we need to remember, which are coming from the ophthalmic artery, and these are the central retinal artery, which can be seen over here, passing through the substance of the optic nerve and then going inside and supplying the retina. Okay, by dividing into the various arcades, superior, inferior, temporal and the nasal arcades. So that is the central retinal artery. Much proximal to the central retinal artery, we have an important artery which is called the posterior ciliary artery. This posterior ciliary artery, which is also called the long posterior ciliary artery because of the long course, is actually going to divide into two parts. One is medial and one is lateral long posterior ciliary artery, based on to what side of the optic nerve they are present. These long posterior ciliary arteries, they fan out much proximally than the central retinal artery, and they are going to go and supply the choroid. And since they supply the choroid, and since they are fanning out much before the central retinal artery, whenever we do an FFA, the first structure that will be seen is actually the choroid, and the way it is seen, it is called choroidal flush. So further in the video I will tell you what is meant by choroidal flush, but what you should remember right now is that since the posterior ciliary artery is coming first from the ophthalmic artery, and then we have the central retinal artery, the choroid is going to get filled up with the dye much before compared to the central retinal artery. Now, these long posterior ciliary arteries are again going to divide into certain short posterior ciliary arteries, and these short posterior ciliary arteries will then supply the optic nerve and the submacular region. However, the remaining rest part of the choroid will be actually supplied by the long posterior ciliary artery. The posterior ciliary arteries, whether it is the medial posterior ciliary artery and the long posterior ciliary arteries, you can see that they actually have a segmental blood supply. That means we have a medial one and we have a lateral one. That means if you divide the fundus into halves, half of it is actually supplied by the medial posterior ciliary, and the other half is actually supplied by the lateral posterior ciliary. And this demarcation line is actually present somewhere in between the optic disc and the macula. Okay, and the part where these two arteries are actually supplying and meeting, that is called the watershed zone. Okay, that's called the watershed zone of the choroid. Okay, so the same thing is being shown over here. This is a long posterior ciliary artery, long posterior ciliary artery, and then we have the short posterior ciliary arteries which are actually supplying the optic disc by forming the arterial circle of Zinn and Haller. So all this is there in detail in the blood supply of the optic nerve. So now the choroid actually has three important vascular structures or vascular layer, we can say. So over here is the retina, and we know the outer to the retina we have the choroid. Now the outermost layer of the choroid is actually the Haller's layer. You can see the Haller's layer is made up of these larger vessels, and these vessels are quite intact. That means they do not have any fenestrations, right? So they do not have any fenestration and there will be no leakage from the Haller's layer. Next to the Haller's layer inside we have a little bit smaller or medium size vessels, and this is called the Sattler's layer. The most innermost layer of the choroid is actually the choriocapillaries, and the choriocapillaries have lots of fenestrations present around them, and the dye can easily leak out from the choriocapillaries. And these fenestrations are also important because through this easily there will be diffusion of the nutrients which can occur, and these choriocapillaries can easily supply the outer layers of the retina with the essential nutrients. This is the diagram which is showing the layers of the retina, and this is simply to tell you that the watershed zone in the retina is present somewhere near the outer plexiform layer, so that the outer layers are actually supplied by the choriocapillaries. That means they are getting their nutrition from the choroid, and the inner layers are getting it from the central retinal artery. Now let us talk in brief about the blood retinal barriers. The blood retinal barriers basically consist of the inner blood retinal barrier, and then we have an outer blood retinal barrier. They play a very important role in maintaining the microenvironment of the retina and also the neurons. So let us talk about first the outer blood retinal barrier. The outer blood retinal barrier is nothing but it is the tight junctions which are present between the RPE. So what I mean to say is that the RPE cells are very tightly held together by the tight junctions, and they do not allow the entry of anything beyond them. Similarly, we have the inner blood retinal barrier which is present in between the retinal capillaries or the retinal vessels. They also have very tight junctions which will also not allow the passage of the plasma or anything into the retina. So fluorescein angiography actually permits a dynamic evaluation of any local circulatory disturbances. So what I mean to say is, whenever there's an infection, there is some inflammation, or there is some abnormal vasculature which is coming from the choroid, and they can penetrate the RPE into the retina, they can grow into the retina. Okay, they're called neovascularization, and sometimes a choroidal neovascularization like CNVMs, or sometimes they can be like in diabetic retinopathy, new vessels which are not having such tight junctions. So such vessels are going to allow the passage of dye that we are going to put in the fundus fluorescein angiography into the retina and will help us in dynamic evaluation of the retina, and will tell us about these pathologies. Therefore, blood retinal barrier is also very important, and specifically on FFA, if we are finding any disturbances, it should actually ring a bell that the blood retinal barrier might be compromised. Either it is the outer blood retinal barrier or it is the inner retinal barrier. So what is the dye that we are using in fundus fluorescein angiography? The dye that we are using is the sodium fluorescent dye. It is actually an orange color dye. So this has a property of fluorescence. So it absorbs the blue light, which is of lesser wavelength, that is 465 nanometers to 495 nanometers. And in response, it will emit the green light, that is a green fluorescence, about 520 nanometers to 530 nanometers. Next question, which is very commonly asked, is what is the concentration of the fluorescent that we use? So the concentration that we use is about 10% to 20%, which is the most commonly used. Okay, so if we are using the 20%, it is usually in 3 ml solution, and 10% one is actually nothing but it is 5 milligrams in 5 ml solution. So that becomes 10%. So how do we actually do an FFA? Okay, so FFA is, or the fundus sodium fluorescence, is actually a solution that we use. So that solution has to be injected into the antecubital vein of a patient. So a syringe with a 23 gauge winged infusion set, or sometimes we can also use a scalp vein needle. And that injection has to be coordinated with a photographic process. So what I mean to say is, as a patient lies down and we are injecting the fluorescent into his arm, simultaneously the photographer should be ready with the photograph for taking the sequential photographs. We have to be very well coordinated. There should be good coordination between taking the photos and injection of the dye. The dye has to be injected rapidly in about 2 to 3 seconds, and then we have to start taking photographs at about 1 second interval. Okay, so between 5 seconds from, like, you have to start taking photographs from 5 seconds after injection, and then keep on taking it every 1 second, okay, till 25 seconds. And then later on we take a late photograph at about 10 minutes. So this is also a very common question which is asked, that how do you take the photographs? At what intervals do you take the photographs in a FFA? One more point that we should remember regarding fluorescence is that about 80% of the fluorescent is not available for fluorescence. It is going to remain inside the blood vessels, and it will be bounded to the plasma proteins which are present inside the blood vessels. Only 20% of what we inject will be available for the fluorescence. The fluorescent will actually diffuse very readily through the choriocapillaries. However, it will not diffuse through the retinal vascular endothelium or the RP. So what did I tell you in previously, that the choriocapillaries actually have lots of fenestrations through it, that is nothing but the pores. So through these pores, the fluorescent can easily diffuse, right? So readily diffuses through the choriocapillaries. However, the normal retinal endothelium and the retinal pigment epithelium, they are forming the blood retinal barriers. So they are not going to allow the diffusion of the fluorescent. However, if there is an abnormal vessel like the neovascularization or a CNVM, okay, that is the choroidal neovascular membrane, okay, then through that you can actually see the leakage. Similarly, a normal RP is not going to allow the passage of the dye. However, when there's a rip in the RP, okay, there's any break in the RP, or if there is a CSR, in those cases there will be leakage of the dye which can be seen. Now let us try to understand how this FFA works. So in an FFA, after we have injected the dye into the patient, now what we'll do is we'll start trying to take the photographs of the patient. Through this process, we are going to pass, number one, a white light through the eyeball. So as we pass this white light that you can see over here, this is the white light, and this white light, before it reaches the eyeball, it has to pass through a cobalt blue excitation filter. This cobalt blue excitation filter will only allow the blue light to pass through the eyeball. So as you can see, this was the white light before, and now as the white light is passing through this excitation filter, okay, the particles will be excited in such a way that only the blue light is going to enter the eyeball. Now again they will go and reach the retina, and from there again the light rays are going to get reflected back. Now both the green and the blue light will get reflected back, and now they are going to face another filter which is present, and this filter is called the barrier filter. So what does this barrier filter do? The barrier filter will now block all the blue light which is coming from the eyeball and allow only the green light to come out. So this yellow green light which is going to come out from the barrier filter will be giving us the fluorescent image and will be giving us the picture of the FFA. So what you need to remember is that in the fundus fluorescein angiography, we have two filters. One is the excitation filter and the other one is the barrier filter. The excitation filter will excite the molecules present in the white light so that only the blue light will go inside the retina, and the retina cells or the vasculature will absorb that 465 to 495 nanometers light, and all the dye which is present in the retina vasculature which we injected, the fluorescent dye, will actually absorb this 465 to 495 nanometers, and then it will emit the light which is of 530 nanometers. And then there's a barrier filter which is going to let only the green excited light to come out from the barrier filter and give us the fluorescent image, and remaining whatever disturbing reflected rays are coming, they will be blocked by the barrier filter, and ultimately we are going to get a fluorescent image. Now there are various phases of fundus fluorescein angiography according to the timing of injecting the dye, and these can be divided into number 1, the choroidal phase, which is called the pre-arterial phase. Number 2 is the arterial phase. Third is the early arteriovenous phase. Then we have the late arteriovenous phase, and then we have the recirculation phase. As we know that the blood flow in the choroidal vessel and also in the retinal vessels can be visualized using the fluorescein angiography. After we inject the dye into the peripheral veins, the sodium fluorescein is going to reach the vascular system in the eye via the blood circulation system and via the central retinal artery that I already told you about. The sodium fluorescein is going to quickly diffuse, and it can actually go within the fluid compartments of the eyeball. However, it will not be able to pass so easily through the retinal vessels and through the RPE. Okay, and therefore whenever we are doing the fundus fluorescein angiography, we are actually testing the integrity of the blood retina barrier. So this is a very important point that we must remember. Now next, there are two vessel systems that I already told you, okay, which we will be testing. The first is a choroidal vessel system, that is a posterior ciliary artery system, and the next one is the retinal vessel system, which is the central retinal artery system. They will have different degrees of extravasation of fluorescein, and then they are going to fill almost simultaneously, and they are actually separated by what? They are separated by the RP. So here is the retinal pigment epithelium, and inside this we have the retina, which is supplied by the central retinal artery mostly, and outside the RPE we have the choroid, which is getting supplied by the posterior ciliary artery. There is only one structure which can allow the dye to freely permeate through it, and that is the fenestrated vessels which are present where? In the choriocapillaries. So remember, I told you there are fenestrations which are present in the choriocapillaries, and outside the choriocapillaries we have the Sattler's layer, and outside that we have the Haller's layer. Now this Haller and Sattler, both of them do not allow the passage of fluorescein because they do not have any fenestration. However, it is the choriocapillaries which are going to get filled up with fluorescein, and they are going to spread very rapidly within the choroid. Now with this basic knowledge, let us start with the phases of the FFA. The first visible change that will occur is that the choriocapillaries of the choroid will be filled up. Okay, and they will be filled up via the posterior ciliary arteries, right? And as they are filled up with the posterior ciliary artery, the phase that we get is the choroidal phase. Now, the time that it takes for the fluorescent dye to reach from the arm to the retina, that is to the eye, is about 9 to 15 seconds, and therefore the choroidal phase will start basically at about 9 to 15 seconds after the dye injection. So the filling of the choroid, because of the filling of the posterior ciliary arteries, which actually have a segmental blood supply. As I told you, there are two main long posterior ciliary artery. One is medial, one is lateral, also called nasal and the temporal, and they have a watershed zone. So this lobular filling or the segmental filling of the choroid will start, and it will initially give us a patchy lobular appearance. However, later there will be a diffuse faint fluorescence of the choroid, which is referred to as the choroidal flush. Now, there are two important things that you should remember in the choroidal phase. Number one is that the cilioretinal artery, if it is present, it will fill at this time because it is derived from the posterior ciliary artery, right? And if this is the fundus and there is a presence of a cilioretinal artery, usually the artery will look like this, okay? So it will be coming from the margin of the disc, and since it is coming from the posterior ciliary circulation and in the choroidal phase, it is the posterior ciliary artery which is getting filled up, the cilioretinal artery can be best visualized on FFA in the choroidal phase, and the macula is going to look dark during the choroidal phase, and the reason I will tell you later. So this picture over here actually represents the faint choroidal flush. So you can see this whitish areas, okay? You can see the vessels are looking dark. Why the vessels are looking dark? Because the fluorescent has not yet reached the retinal vessels. Only the choriocapillaries are getting filled up, and as they are getting filled up, you can see a faint whitish fluorescence in the background, and on top of that you can see the black retinal vessel, and this indicates the choroidal phase of the FFA. Next, let us talk about the arterial phase of the FFA. The arterial phase starts about 1 second after the onset of choroidal fluorescence. So on an average, what did I tell you, that the arm to retina time is about 9 to 15 seconds. So the choroidal phase is 9 to 15 seconds. On an average, if you take it at 11 seconds. After just 1 second of the choroidal filling, the arterial filling or the arterial phase of the FFA will start. So the arterial filling actually starts with the filling up of the central retinal artery. I already told you that the retinal system of the vasculature is actually coming from the central retinal artery. So the central retinal artery will get filled up, and then the blood will flow through the retinal arterioles, and finally they are going to go into the capillaries. So up to this from the capillaries, and then again this is called the post capillary venules. So all this passage actually constitutes the arterial phase, passing and filling of the central retinal artery, retinal arterioles, capillaries, and then we have the post capillary venules. Now this picture over here actually depicts the arterial phase. You can see that there is a background fluorescence which is coming from the choroid, okay, all these things, and then you can see the veins are still darker in color because they are not filled. However, the arteries have started to get filled up. So this is the one artery which is actually, you can see it is looking whitish in color, and then over here also the peripapillary arteries, they have started to get filled up, and this is called the arterial phase, which occurs about 1 second after the choroidal phase. The next phase after the arterial phase is the early arteriovenous phase. Okay, the early arteriovenous phase, what happens is that the fluorescent is now going to flow from the postcapillary venules into the veins. So it is the beginning of the filling of the veins of the retinal vasculature. This occurs about 1 second later, that is about 13 to 14 seconds. And what happens is that we are going to see a laminar flow or a trilaminar flow. So what is meant by this laminar and the trilaminar flow? So as the fluorescent is flowing, the fluorescent is going to actually dissolve in the plasma mostly. And in the blood vessels, what happens is that the plasma is going to flow very fast, and it flows along the walls of the vessels, whereas the RBCs are actually going to flow axially in the center. And therefore, in the beginning, the fluorescent is also going to flow along the walls, and it is going to give fluorescence only along the the vessels wall of the, or sorry, the walls of the vessels, and therefore it is called the laminar flow. And wherever there is a bifurcation, there it is called a trilaminar flow. This picture over here, you can see that here there is a choroidal fluorescence. That means the choroidal phase is over. The arteries are also filled up with the dye, and the arteries are looking whitish in color. That means the arterial phase is also over. And now let us look at the veins. You can have a look over here. The vein is actually showing early laminar flow. Only this vein, which is very close to the disc, you can see there is laminar flow, and the periphery of the vein is actually completely empty. So this is the early arteriovenous phase. Now over here you can see the laminar flow is present over here near the disc, and it is also present in the periphery. Okay, see here also laminar flow is present, here laminar flow is present. So, and here you have a trilaminar flow because there's a bifurcation. So this is actually a mid AV phase in which the trilaminar and the laminar flow have actually reached the periphery of the veins also. Finally, we have the late AV phase or the venous phase, in which the entire vein is going to get filled up with the fluorescein. And here the dye is going to completely fill the vein, and it is going to take about 8 to 10 seconds total time for it to flow from the artery to the vein. So let us see how. So the early venous phase, the timing was 14 to 15 seconds from the injection. Mid venous is about 16 to 17. Late venous is 18 to 20 seconds, right? And how much is the difference? How much time it is taking from coming from the artery to the vein? That is about 8 to 10 seconds, and this is called AV transit time. Now in the venous phase, this is the best phase in which we can actually visualize the perifoveal capillary network, and it is best visualized at about 20 to 25 seconds from the injection. So this is a picture in which you can see the choroidal phase is present, it's completed, the arteries are filled up, and the veins you can see are looking completely whitish in color. That means this is a venous phase, or we can say this is a late AV phase in which the entire vessels are actually filled up. And this is the best phase in which you can actually study the perifoveal capillary network. So just look at these veins over here, all of these are filled. So if you want to study the fovea and if you want to study the perifoveal capillary network, it is advised that you do so at a time frame of about 20 to 25 seconds. And in the end, we have one phase which is called the late phase or the recirculation phase. So the first pass of the fluorescence circulation is actually completed in about 30 seconds, right? So we observed that all the phases were completed by about 20 to 25 seconds, and we can say it is about 30 seconds. So what happens is that after 30 seconds, the fluorescence is going to again get recirculated, again it will get diluted, again it will come back into the eye, but with each recirculation the fluorescence is getting diluted and the fluorescence will keep on decreasing and ultimately the fluorescence is going to get disappeared from the eyeball or from the retinal circulation in about 10 minutes. Now this picture over here shows the late phase or the recirculation phase, and you can see that the choroidal fluorescence has now become patchy. You can see certain dark areas. That means that the choroidal phase has now going away, and even the retina, you can see the vessels, they're not as bright as they were in the venous phase. Now what happens normally in the late staging or the recirculation phase, which you should remember, is actually the staining of the disc. So a normal disc will stain in the late phase or in the recirculation phase. Now this might not be so evident, however, if you compare this from this image. So this is the venous phase or the late AV phase, and this is actually the recirculation phase. So just have a look at this recirculation phase and the venous phase. Just compare the vessels. How bright are the veins looking over here and how dull do they look over here? And look at the choroidal fluorescence also, how it has become more patchy in the second image. That means the dye is now actually disappearing from the retinal and the choroidal circulation, and the disc has actually started to getting stained. Now along with the disc, one more thing which you should remember is that during the late phase, the choroid sclera, all of them will get stained and they will result in a diffuse background fluorescence. However, it will not be like the choroidal flush that we see during the choroidal phase. The disc also will remain fluorescent in the late films, and all this is because of staining and not because of any leakage. Coming to the foveal avascular zone, the dark area that we see in the center of the image of the FFA is actually the fundus fluorescein, that is the foveal avascular zone. Now the question arises as to why do we see that dark image? So this is the foveal avascular zone, that is the zone in which, there is no blood vessels. And why this area blackish in color, whereas the other retina, as you can see, is showing a choroidal fluorescence? The reason is that, number one, there are no blood vessels present in the foveal avascular zone. Since there are no blood vessels present in the foveal avascular zone, there will be no fluorescence. Number two, the blockage of the background choroidal fluorescence will occur because of increased density of pigments which are present in the macula. Now in the foveal avascular zone, we have xanthophylls and melanin present, and because of the xanthophyle and melanin present, the background fluorescence will be blocked because these pigments have a tendency to absorb these they are very dense pigments, and therefore the fluorescence which is occurring from the underlying choroid will also be blocked by the overlying black pigments. At the same time, the RP cells which are present in the foveal avascular zone, they are quite tall RP cells and they are quite large RP cells, and as they are tall, they are going to contain more amount of melanin and lipofuscin than anywhere else in the retina, and the same reason they are going to block the underlying choroidal fluorescence, and that is the reason why the FZ will look black or darker in the FZ.